Hi, and welcome to the Age Well podcast. This is a relaunch of this podcast series, very much now focusing on the concept of frailty and, more importantly, how we can prevent frailty. What is frailty? It is a medicalised concept that is an umbrella term for lots of health symptoms and conditions that usually leads to somebody becoming physically frail. And I want to give you a bit of background and a bit of context to where this term frailty comes from, and also to reassure people that this is not an inevitable part of ageing. It is very much preventable, and if caught early, it can be reversed. So currently, just to give a bit of background, frailty is a medical term. And the history of the term frailty goes back to around about the 1980s. And it was a term that was used in relation to institutionalization. So for people who had maybe a pre-existing disability, those who were vulnerable to becoming frail. And then it was recognized that there were a number of health conditions that could be identified and could lead to somebody becoming frail. And there are a long list of signs and symptoms and risk factors for frailty. Now, as my clinical background as a registered nurse, I worked predominantly in emergency nursing for almost 20 years. And I had a real interest in frailty within the context of emergency nursing. Because what I would see would be people presenting to the A&E department with pre-existing conditions that may have made them more susceptible, for example, to a fall. So somebody with a history of falls or a fear of falling can very much be an indicator of frailty. And we know that if somebody has a fall, and just to put this into further context, within the NHS healthcare system here in the UK, people are not screened for frailty conditions until they reach the age of 65 or over, because that is when somebody is deemed more susceptible to becoming frail. So I will challenge that shortly, but I just wanted to give you further background about where this term frailty comes from. So what I would do within the A&E department, and I chose to use this as part of my project for my dissertation for my Masters in Advanced Practice, is I devised collaboratively with the physiotherapy and occupational therapy team a frailty screening tool to be used in the A&E department, whereby we could ask patients a series of questions, and if we did actually identify any conditions of frailty, we would expedite the patient to the acute frailty unit. So it meant that that person ideally wasn't spending too long in the A&E department. Now, it depended on what the person was presenting with. Obviously, if they were presenting in the case of an emergency that needed urgent and emergency care in the A&E department, then that would be dealt with first. But the whole premise of the acute frailty pathway was to identify conditions of frailty so that we could get the person to a place where they would be supported by the multidisciplinary team, so therapists, nurses, doctors, pharmacists, whereby they could start the process of identifying what the underlying cause of frailty was and providing a of rehabilitation, which would then continue into the community. And that was the idea behind the frailty pathway. So that was back in 2015 was when I finished my Masters in Advanced Practice, and then I went to work in primary care for 3 years. So I moved from the emergency department to a GP practice, and I attempted to continue my work with the frailty screening tool that I devised into the community. But what I observed was, and what I experienced was, not barriers as such, but challenges in being able to support people and identify and prevent frailty in a health system that is really constrained in terms of time and resources. And, a GP appointment, so I was working as an advanced nurse practitioner within a GP practice, so I would have 15-minute appointments, usually for acute and on-the-day presentations. So it didn't really give me an awful lot of time to be able to sit and do a full and comprehensive nursing assessment of the patient, to be able to identify if they had any conditions of frailty, and then to put that support plan in place, because again, it very much depended on resource. So that was my experience, and I know that's an experience that a lot of my healthcare colleagues share, and it can be quite frustrating, and I'm sure it's extremely frustrating for our patient population as well, and people who live within our community. So that was in 2015. We're now in 2026, and within that 11 years I moved into higher education. So I work as a lecturer and I teach nursing. And I teach nursing at a pre-registration level, but also as a post-qualifying level, and I teach advanced practitioners as well. So everything that I teach is primarily to do with nursing. I do teach other allied health professionals as well. Alongside that, also, I have been obviously getting older, and I turned 50 last year. And within the last 10 years or so, actually more than that, I would say in the last 15, 20 years, I've become increasingly interested in health. Now, you might think to yourself, well, you're a nurse, obviously you're going to be interested in health. And to a certain extent, I would agree, but also, just for those of you who are listening who don't work within the health system, it can tend to be a very disease-focused system, and can also be quite a reactive system to work in, as opposed to proactive. Now, that is not a criticism, it's just my experience. And I see a huge potential within the healthcare system, especially within the nursing profession, for health promotion and ill health prevention. The challenge is again, it's the time, having the time and the resource to be able to provide that level of service. So as a health coach, I would spend at least an hour to 90 minutes with a client just on the initial assessment and consultation. So that's taken a really in-depth history, really looking at the individual's lifestyle, the environment in which they live, the relationships that they have with, family. So all aspects of their life and lifestyle would be considered through the lens of health. Compare that to somebody presenting to a hospital, NHS hospital, or a general practice. You're lucky to get that amount of time to spend with somebody to go into that much depth. This is my opinion, but I know it's the opinion of others in terms of what I've read of the literature and the research in recent years. There really does need to be a shift in focus within health. And we're starting to see this narrative. There are some really good organisations within medicine and nursing and other health professions that are starting to be more outspoken about this. And even here in Scotland, the Scottish government has made recent pledges to focus on improving the health of our population here in Scotland, because certainly since COVID, the health trajectory of the general population is heading in the wrong direction. Now, I see that as an individual within my community. I see that as a nurse. I see that as a health coach. It's something that I see and discuss with friends, family members, colleagues. The general health of the population is not good, generally. Now, you will see some really good examples of, people who are extremely fit, extremely healthy. There's been a bit of a resurgence in interest in, going to the gym and lifting weights, and there's lots of information out there about the type of exercise we should be doing, the type of foods we should be eating. I would suggest that a lot of that information can be quite confusing and quite conflicting for people to try and unpick and identify, what is helpful and what isn't. And in addition to that, within nursing education, there is not enough emphasis on health creation. We do teach and we do discuss health promotion, motivational interviewing, brief interventions. There are concepts of health promotion within the curriculum, but we don't spend enough time on the subject of health creation. So, for example, nutrition and the science of nutrition is very seldomly covered within the nursing curriculum. And also, in addition to that, I am increasingly concerned about the health of the nursing profession. And, my health has been affected negatively during the 30 years I've spent working as a nurse. And that is not anybody's fault. It's, I've now learnt at this stage in my life what health means and the steps that I need to take and the responsibility I need to take for my health and well-being. And, the main issue in terms of health of the health professions is stress. And we know that chronic stress and chronic inflammation, which are two concepts that I am going to focus on a lot within this podcast, because it's the main culprit for most chronic ill health that we see today within our communities. So that's just to give a little bit of a background about where my interests lie, why I decided to focus on aging well as a health coach, why I'm also wanting to focus on frailty and frailty prevention. And also I want to share this knowledge with you in a way that is accessible, in a way that is, it's not expensive. It doesn't mean that you need to go out and buy a lot of equipment. It's really simple interventions that people can start to think about introducing in small steps on a daily basis. So who's this podcast aimed at? It's aimed at anybody who wants to listen, and there is no age limit. Now, although this is the Age Well podcast, physiologically, we actually start as humans to age from the age of 30. There is no, and arguably we're aging from the day that we're conceived, but anybody who's got an interest in their own health and well-being, or if you work with the aging population, if you're interested in this podcast because you'd like to support your close relatives, friends, you work within the community, this podcast is for anybody who is interested. In terms of frailty and frailty prevention, I am here today to argue that we need to be thinking about frailty and screening for frailty much earlier. 65 years of age is too late. And the reason why I say that is because, here, for example, here in Scotland, Public Health Scotland recently released data relating to healthy lifespan. So the number of years that you can expect to live in good health is at a 10-year low. So that means that potentially, for women, you can expect to live 60 years in good health. Now, if my lifespan is 80 years, then I can expect to potentially live 20 years of my life in substandard, poor health. Which is why we often hear the media talking about people living longer, which may put a strain on health resources. The increase in demand for health services has increased exponentially since the NHS started. If we look at the NHS back when it started in the 1940s to where we are now, and the level of services that are available, the level of treatments that are available, and in addition to the number of health conditions that we now treat within the NHS, it is an issue. And by focusing on health much earlier, and having those conversations within our communities and making sure that we've got the right services in place for people to access to stay healthy is the way forward, but it's going to take quite a significant shift in the way our current health system works. So that's what I'm here to talk to you about. And, each week I'll be covering a different aspect of aging and how we can age well. But for this episode, I just wanted to give you a further overview of the concept of frailty. So, as I said, people currently within the NHS are screened for conditions of frailty age 65 years and older. And the reason for that is as we get older, our physical resilience decreases. So what does that mean? It means that our ability to bounce back from illness, stress, grief, a significant life event diminishes the older that we get. And there are certain risk factors that put us at more risk. So obviously, if you've already have chronic illness, so it means an illness that you've had for a long period of time. So diabetes, type 2 diabetes is a condition that is really prevalent within our communities. And unfortunately, it's a condition that is even prevalent within children now as well. So type 2 diabetes, arthritis, asthma, COPD, these are all chronic long-term conditions, high blood pressure, heart disease. So if you already have pre-existing chronic ill health, as you get older, this will put you at a further risk of frailty. Also, I mentioned falls. So if somebody has experienced a fall or has a fear of falling, that increases the risk of frailty. Decreased grip strength. Now, we've heard a lot recently, which is great, about the need for older people to maintain physical strength. And it's recommended that all people should be aiming to do strength and resistance training at least twice a week. So decreased grip strength is an indicator for frailty. Things like malnutrition. So if somebody has a poor appetite or has lost weight unintentionally, so losing weight without trying to lose weight. Now that can be a more serious indicator for other diseases if there are other signs and symptoms. But for frailty, unintentional weight loss and poor appetite can also increase risk of frailty. Delirium. So delirium is not the same as dementia. It's important to reiterate that. So delirium is an acute, sudden confusion, usually brought on by infection, for example. And obviously, once the source of the delirium is treated, the delirium should settle and go away. But if somebody has had delirium, they are at increased risk of developing delirium again. Poor mobility. Yeah, so lots of different sort of risk factors for frailty. Sedentary behaviour. Sitting for long periods and not moving has a significant increased risk for frailty. And I will do an episode about exercise primarily because, again, there's lots of different information out there about exercise and what exercise people should be doing. But what I want to reiterate in terms of frailty is that the important thing is to move and move regularly. So rather than, if you were to get up in the morning and go out for a 5-mile walk, which is great, you're also getting daylight, which is going to help with your circadian rhythm and sleep, which we'll come on to in another session. But if you were then to go home and sit for the rest of the day, then it's going to really cancel out that 5-mile walk that you did in the morning. So the emphasis is on movement, any movement, and moving regularly. So this is a really important one as well. I've mentioned malnutrition, and the majority of people within our communities are malnourished. Now, this is because of the quality of food, people are eating, and some of that has to do with what people can afford as well. We know that the price and the cost of food has gone up significantly in the last couple of years. And it's a real barrier for people to be able to be healthy. And this is something that really should be spoken about more at government level. But the quality of the food that we eat is really important. And there's been a lot of information in recent years about ultra processed food, sugar, sugary drinks. So the quality of the food that we're eating is really important. And so when I talk about malnutrition, it means that you are missing essential nutrients. So that could be vitamins, it could be minerals, it could be electrolytes, it could be protein, it could be fiber. So the body, we are literally what we eat. Our body is recycled food and nutrients that we consume on a daily basis. So a good place to start, actually, if you're thinking about frailty prevention, is to start to look at the food that you're eating on a daily basis, and maybe even keeping a food diary, and just starting to make some of those simple swaps. And again, I will do a completely separate episode. It'll probably take a couple of episodes actually to cover nutrition, because there's so much in it. But it is so important. So, regular movement, healthy, nutritious food, and it needn't be expensive. So I'm really going to simplify what healthy food looks like, and it needn't be expensive either. One of the things that you can do, one of the best skills that you can learn at this stage in your life, wherever age you are, is to learn to cook. So if you enjoy cooking, if you can cook basic meals for yourself, great. If you are somebody who is a reluctant cook, doesn't know how to cook, certainly where I live here in Scotland, there are lots of community-based cooking lessons and cooking classes and cooking clubs that people can join. So it really is worth thinking about investing in a course to learn to cook, or technology, YouTube videos, buy a recipe book. But I think, if you are somebody who struggles to cook or can't cook, then, that might be a priority for you as well. So these are some of, as I said, the risk factors around frailty. Symptoms of frailty range from, so when we're screening somebody for frailty, it's like a sliding scale. So it goes from somebody who is very fit. So that is somebody who is exercising regularly, eating well, doesn't have any pre-existing health conditions, isn't prescribed any medication, is very fit. That's our starting point. And this is the point that we want to hopefully get people to and keep people at. And then the next stage is, moderately fit. So this is somebody who does exercise, but is maybe more of a sort of seasonal activities. So somebody who might be more active in the spring and summer, for example, and might be a little bit more sedentary in the autumn and the winter. Doesn't have any sort of chronic health issues. And then the scale sort of works its way down from there. So then you might get somebody who is quite sedentary, doesn't do any regular movement or exercise, maybe has one or two chronic health conditions, and then, somebody who then is struggling to maintain their own activities of daily living, so they might need a little bit of support getting the shopping in, and then all the way through to somebody who is then at the end of life. So whereby they are not able to mobilise at all, they're needing a lot of support, a lot of care. They're not expected to live more than 6 months because of frailty, and frailty is actually something that can be recorded on somebody's death certificate. So yeah, that's where we're going from sort of very fit all the way through to end of life. That is the sort of the scale of frailty. Now, the hope is that at the sort of more earlier stages of frailty, if we can capture that and work with the person to improve health, that we can potentially reverse some of those frailty conditions. And I would include chronic health conditions in that as well, because a lot of chronic health conditions are reversible. I would suggest that as we get towards the latter stages of frailty, it becomes more difficult to be able to reverse frailty. So ideally, we want to start this conversation much earlier, and much earlier than the age of 65. at least from the age of 50. We know from the, when we hit 50, we get all those appointments through, don't we, from the GP wanting to do lots of health checks and things, because we know from the age of 50 onwards that we're more at more risk of developing chronic ill health. So at least from the age of 50, we want to be thinking about this. So this is frailty. This is what I'm going to be discussing over each week, looking at a different aspect of health and how this can impact on aging and preventing frailty. Because my mission is to prevent frailty. This is a condition that is absolutely preventable. It's not an inevitable part of aging. And I think if we can start to change our perspective and our perception of health as individuals and as a community, and it is empowering. It's empowering when you understand and you're able to take full control of your health with the support of the healthcare system. Absolutely, the healthcare system, when it's needed, for something, is great. But there's a lot of things that we can be doing as individuals to prevent a lot of the diseases that we see in today's society. And approximately 80-90%, I would say, of non-communicable disease. So non-communicable disease, so this is not something that can be passed on from one person to another. So that's most of our diseases are preventable and are usually lifestyle related, and even more so are closely correlated with chronic stress and chronic inflammation. Two conditions that I will explore in depth, because they're two areas of health that I'm extremely interested in, and something that I am observing more and more in the people that I interact with on a daily basis. The next episode, we'll start to have some discussions around some of those factors relating to aging well. But hopefully this has just given you an introduction to the concept of frailty, just putting it out there, getting it into people's minds, thinking about it in terms of your own health and well-being. Thank you for listening, and I will speak to you soon. Bye for now.